Well, good morning. Showing 10 o'clock, I am going to call to order the special meeting of the Kansas State Board of Education to order. We only have one action item today, so we are doing our meeting virtually. I would like to roll call the members so that we have a verbal from everybody when you, so please, when I call your name, please answer. And so we may have to unmute for just a moment. So Janet Waugh,
Here.
Steve Roberts,
Here.
Michelle Dombrowski,
Here.
Ann Maw,
Here.
Jean Clifford,
Here.
Dina Horst,
Well,
okay,
here.
you're okay. Thank you, Dina.
I can't deal with my mute, I guess.
Ben Jones,
Present.
Kathy Bush, I'm here. Jim Porter
Here.
and Jim McNeese.
Here.
Okay, now we can mute. Thank you. All board members are present. We'd like to welcome everybody who is listening in and watching on live stream to our special meeting today. We have a number of things we will be going through as we are working through our decision whether or not to support a resolution regarding the executive order. We have some folks present today who are going to share with us. I would like to read the mission statement of the Kansas State Board of Education, which is to prepare students for lifelong success through rigorous quality academic instruction, career training, character development according to each student's gifts and talents. Our vision is for Kansas to lead the world in the success of each student. Randy, are you going to put the flag up for us?
Yes, ma'am. Let me do that right now.
Okay, and if everybody would stand and join in on the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. Always a little bit difficult to do the pledge on Zoom. We have a little bit of a delay.
Madam Chair, I believe that you got muted. If you could unmute.
Thank you. Okay, there we go. Thank you very much. Okay, thanks everybody for joining in with the pledge. For today's agenda, we have our one item on the agenda, as I mentioned earlier, so I'd ask for a motion to approve the agenda. Members, if you just raise your hand. Ben Jones approves the agenda. Steve Roberts seconds. All in favor, please raise your hand. Michelle, do you want to unmute so we can hear you?
Yes, I raised my hand.
Okay, thank you very much. That's a 10-0 to approve the agenda for today. Okay, just a little bit, board members, as far as how we're going to proceed for the day. We have a number of guests here today who are going to go over some information with us regarding the executive order. We will first be hearing from Scott Gordon, and then Will Lawrence, I believe, is on from the governor's office, or will be. And then Dr. Lee Norman from KDHE is on, and they will each explain different parts of the information that for today. And what I'm going to ask is, after each group has presented, board members, for instance, will start with the legal aspects of the executive order, and after that, the information is presented, probably will be Scott and Mark Ferguson will probably jointly do that. I would ask if board members have a question, You can either raise your hand or put it in the chat box, and I will acknowledge you for the questions on that section. Then we'll go to the next section. We'll hear from the governor's office next, and then we'll hear from Dr. Norman for that. After that, we'll follow with, I'm going to make a few comments before we start. Then we'll have board member statements. You'll all get an opportunity to make your own statement. After everybody's had an opportunity to make a statement, we'll have a motion regarding the resolution, and then we will do a roll call vote. So that's the procedure we'll go through today, and I will go back over that after we kind of move from one section to another. So we will start first off to ask Scott Gordon, and I believe, Mark, you're joining on this, to go over information regarding the executive order. I am going to mute, and then once we get to the point where they presented our information, board members, if you have questions, again, please use the chat or raise your hand when we're ready for questions. Thank you.
And Madam Chair, can I just interject a couple of things? The
Please do.
presenters will have access to share your screen if you're wanting to do so. And I want to also say that Michelle Dombrowski is in an area where she does not have video connection. We're working on that. Try to at least get her photo up. Our IT people are working on that for those that are watching that may be wondering. So, Scott.
Okay, thank you, Commissioner Watson and Madam Chairwoman. So to summarize how we got here, you know that during a special session of this last year, the legislature passed House Bill 2016. And within that particular bill, there is a provision by which the State Board of Education reviews executive orders. And it's very brief, so I'm going to read it. For those following along at home, it's page 4 of House Bill 2016. New section 7 states that notwithstanding any other provision of law to the contrary, no executive order issued by the governor pursuant to KSA 48-925, which I will tell you that the executive orders have been issued pursuant to that statute, and amendments thereto, that has the effect of closing public or private school attendance centers in this state shall be effective unless and until such order has been affirmed by the State Board of Education by adoption of a resolution by a majority of the members of the State Board. Prior to issuing any such executive order, the governor shall submit such proposed executive order to the State Board of Education. Upon receipt of such proposed executive order, the State Board shall meet as soon as reasonably possible to review such proposed order, and if a majority of the members of the State Board determines such order is in the best interest of the students in this state, to adopt a resolution affirming such proposed executive order. So that's how you have the proposed executive order in front of you, and that's what you're voting on today. There were actually 2 executive orders that were announced by Governor Kelly, and just briefly touching on Executive Order 59, that has typically been referred to lately as the face mask requirement. Obviously, there's several other requirements of that particular order. I would tell you that that executive order is not subject to prior approval or review by the State Board of Education. So that one and the provisions of that are not before you today. And Mark and I can answer questions for you later on, or Mr. Lawrence from the governor's office may be able to answer some questions if you have any, but really that's not what's in front of you. The only thing that's in front of you today, and you have a copy of this, is Executive Order 58. And Executive Order 58, although it does say in there that the State Board has already voted to approve it, the reason why that language is in the order is it assumes that you're going to vote yes. If you do not affirm the resolution, the executive order goes away and it never gets signed. So looking specifically to Executive Order 58, and I know that this is provided to all of you ahead of time, looking to page 2 is really where the meat of this executive order begins, at the bottom of that page. This goes into effect starting August 10th. And essentially, from August 10th through September 8th, students are basically public and private schools, K through 12, shall not allow attendance, instruction, athletic practice, or competition rehearsal, performance, or other interaction of an instructional manner, including virtual, online, or any other direct or indirect means of providing instruction between faculty and staff and students of public or private K-12 schools between August 10th and September 8th of this year. In a nutshell, if you have questions as to whether or not they can do this, the answer is probably going to be no. And we'll get to that when you have specific questions. There are certain exceptions. The first is for students that are concurrently enrolled to receive college credit. You have many high school students that they get credit through maybe a local community college or other post-secondary education. It may be a VOTEC institute. That is allowed. And that may occur if they're receiving instruction even from a high school teacher, so long as the instruction is happening off campus, so long as it's not in the public or the private K through 12 building. That's fine. The second exception, or the clarification, is the enrollment of students for the upcoming school year, the 2020 and 2021 school year. Students can be enrolled. Any other administrative activity that is required to get the school year started, that's allowed. And finally, any kind of screenings or evaluations. I know we have evaluations for pre-K students, screeners. We know we have evaluations for English language learners and several other individuals. If it's the development of an IEP that needs to take place during that month, all of that is allowed because that is all considered to be administrative to set up the instruction, and it's not the instruction in and of itself. So those are the exceptions. Those things can happen within that month that the buildings are closed. Anything else, such as pre-K, after-school programs, busing for other programs, that is all to be worked out between the schools and the local and county health departments to determine if it's appropriate during that month to have those other activities while complying with all of the directives of the other Bill EO 2059 and any other orders by your local health office. The non-accredited private homeschools. So anyone that's homeschooling, none of these provisions apply to homeschools. That was clarified and is included in the draft of the executive order you have in front of you is number 3. And then number 4, the idea is every other executive order that's been issued that's currently in place, including EO 59, the idea is to read those in harmony. So that's the executive order you have in front of you. And the question for the state board is, do you believe that this is in the best interest of the students of the state of Kansas? That is why we drafted a proposed resolution, which I think is next in your packet. It's resolution 2020, number 1. I'm not going to read the whole thing to you, but essentially we use language in there to make sure you are in compliance with the statute. That if you believe it's in the best interest of the students of the state of Kansas, then you are affirming the executive order that will be issued by Governor Kelly that would have the effect of closing schools. Even on a temporary basis, it still has the effect of closing the schools. And the motion that you have before you today really is, it's a straight up and down vote. You either are in favor of signing this resolution or you're not in favor of signing the resolution. If you don't sign if you vote no, and you do not affirm the executive order, and Mr. Lawrence can speak on this as well, it's pretty much dead. That executive order will not be signed. It will not be issued by Governor Kelly. And then we'll just see what other actions may be necessary after that. That's the Reader's Digest version. And if there's any questions, I haven't seen any in the chat and I haven't seen any arms go up, but Madam Chair, Mark and I can answer any questions that you all may have.
Mark, do you have anything to add?
No, ma'am. We've talked about this leading up to it, and that's a good summary.
Okay. All right. So board members, any questions? And these questions would be specifically regarding the executive order. So Ben Jones has a question. Ben?
Thank you, Madam Chair. Just to clear up the definition of accredited, that's state accredited institutions, correct?
That's correct. That's
So
basically anything accredited by the State Board of Education.
okay. So those schools that do participate in CASHA activities, but are not accredited by the state board, this would not affect them, correct? This is just for clarification.
No, it would still affect them. The only ones that do not, that this executive order would not apply to would be a homeschool. So I believe there's approximately 30, give or take, non-accredited private schools that would not be typically referred to as a homeschool. I
Mhm.
believe the intent is that this executive order would apply to those schools as well.
Okay, thank you.
Jim McNeese.
Thank you, Madam Chair. Can this executive order be amended or changed or modified in any way by us today? Thank you.
No, you are not in a position to amend or change the executive order. Your authority is only, you're either going to approve it or you're not going to approve it. Mark, I don't know if you have a contrary position, but I think that's all you have. That's what you get.
Janet Waugh has a question.
Thank you, Madam Chair. My question is, I'd like a clarification on the early childhood piece and including parents as teachers. How does this impact these programs?
That I think would probably not be, and I'm going to get this wrong and I apologize. That's probably not considered an instruction specifically from the faculty and staff to the students. So probably is not contemplated by saying you can't do it.
Okay, thank you.
Dina Horst.
Thank you, Madam Chair. When we're talking about non-accredited schools, would that include the homeschool coalitions that sometimes exist that are, I think they're called macro schools or something of that sort? In other words, they still meet in homes, but there are lots of students from other families that would be included.
So I believe the intent is, and I understand that there are several cooperative learning programs and groups that will work together for homeschooling, but because the actual schooling would occur in homes, I don't think that you would consider those cooperatives to constitute a school in the traditional sense, and they would probably still be exempt from the executive order.
So they have to be meeting in a different building to be considered non-accredited schools as such as what is covered in this EO.
So I don't want to say that's an absolute yes, because there may be homeschool programs that do meet, maybe, I don't know. I will tell you this, there is no statutory or regulatory definition of a homeschool. They are by law, non-accredited private schools. But it's one of those, you know, generally if it's operating out of a home, it's a homeschool. It's.
But those schools that have been formed, for example, by a church that just do not happen to be accredited by the department would be included.
I believe the intent of this executive order is to include them, and these provisions would apply to those schools.
All right, thank you.
Other questions, board members? Okay, seeing none, I think we're going to move on, and we will have from the governor's office, I believe it's Will Lawrence. So Will, welcome.
Thank you, Chairman Bush and members of the board. I appreciate the opportunity to address you today. I will cover kind of, I think, the key points from the governor's perspective, and then I know Dr. Norman will talk in more detail about the health side of things. But I've kind of broken this down to a couple of categories, and the first one I want to talk about is the reason and rationale for the delay, and why the governor implemented or has sent this executive order for your review. One, the current case count for COVID-19 in the state is it's higher than it was back in April and May when we had our peak. And we thought was going to be the first wave, and then hopefully we wouldn't see more cases until later in the fall. Obviously, that's turned out to be a little bit different than we anticipated. We're sitting here July 22nd, and the number of cases in Kansas are growing at a great level, and we're now one of 18 states that are seeing a huge spike in cases. And earlier in the year, we had a lot of rural counties that didn't have any cases. That's really no longer the case. We're down to 2 or 3 counties that don't have any cases. So it certainly is continuing to hit some of even our more rural, smaller communities are now having problems with COVID-19. And so that has certainly presented a challenge, whereas we thought initially schools would start on time, may have to end early around Thanksgiving if cases were to come back up. Certainly now we're presented with a real challenge with June and July being bad months again. So part of the reason for the delay here is to give us more time to flatten that curve again by doing things like wearing face masks. And some of our communities, Topeka, Douglas County, Wichita, and Kansas City are doing more things to help flatten the curve. And we need to give them time for that to work so we can have a safe environment to open schools again for in-person learning. The second thing is that this gives school districts more time to prepare to open up in the fall. The plan that you released and approved last week obviously is a very detailed, excellent plan. Gives school districts a lot of options and how they're going to conduct a school year. And one of the things that we've heard is they need more time to prepare for that. And there's been some conversation about, well, could we let them start early or start on time and go online, and then after Labor Day, start the in-person classes? Well, in theory, that sounds like a good plan, except for the fact that we have heard from a lot of teachers that don't believe they're prepared right now to even begin the online portion and would like to have more time for professional development and do things that would allow them to be more effective in teaching online. Additionally, all school districts would probably go online right away. And that would take away the 3 weeks of additional time for teachers and administrators and everyone to plan and prepare to begin after Labor Day. So it's giving everyone that opportunity to do that. And we think that's really important. And the third thing that I want to touch on is just predictability for families and for employers. One of the reasons that the governor went ahead and issued the order in the spring to close schools for in-person instruction in the spring was that we were looking at a situation where we didn't know where the cases were going to go, and school districts may try to weather the storm, so to speak, and they're going to be going from open to closed, and that is really difficult for families, it's really difficult for students, and it's really difficult for teachers. And so the best thing to do at that time was to go all online, and with some limited exceptions for students who couldn't be taught in that manner. Same thing here. When schools open, we've heard from the business community, and one of the things they've talked about is, when schools open, they need to be open, need to stay open, have a predictable schedule. And so if you go with, the hybrid option or something like that, it's going to provide that regular schedule for parents and for students. And if as a parent, you've got a regular schedule, you can work with your employer that gives you the ability to go to work, and they know when you will and won't be there, as opposed to, this week you can be at work, but next week you can't, or it's, we have to have a lot of back and forth on that. So that was another consideration here. And a couple of things I do want to touch on that we've heard is that this takes away local control. I would push back on that. While it takes away the ability for schools to decide if they're going to open on time or have a delay, this does delay all of them. But it certainly doesn't take away the ability for them to decide how they're going to use that time in terms of preparing their teachers to begin the school year on September 9th. They still have the guidance document that came from the state board, which allows them to figure out which plan is going to be best for them and how they may have to shift back and forth. They may start in an all in person, and then they may need to shift to a hybrid model, or they may have to shift all online or start all online, but it gives them more time to kind of figure out how they're going to operate within that guidance. And we've heard overwhelmingly that that's what school districts want and what they need. The second thing that we've heard is a lot of people are saying, well, look, this doesn't impact children. Some of them may get sick, but they don't get very sick. They recover quickly. So what's the problem? There are a few problems with that. One, we're seeing more students test positive, more children test positive at a higher rate than we saw in the spring. So we're continuing to learn more about COVID-19 as time goes on. But even if they recover quickly, for the most part, some of them will have bad outcomes. Additionally, you've got teachers, staff, faculty, administrators, and then you've also got the people who will interact and provide care for the students outside of school, parents, grandparents, other caregivers, and they may have underlying health conditions. They may be in a group that has been known to have bad outcomes with COVID-19. And so, those are all things that have to be taken into consideration here as we're thinking about how the fall is going to work. And again, all that points back to the fact that I'm giving 3 more weeks of time for schools to prepare. It's, while I understand, on the legal side of things, it certainly fits the definition of the statute in terms of a closure. It's not closing schools for the semester. It's delaying 3 weeks to give people more time. And they need that time, and they need to use that time, appropriately to prepare for that. And hopefully, they'll be doing professional development, things like that. We certainly would support any efforts to make that happen. But those are the things that they need, and that's why the governor has gone this direction with the 3-week delay. The last thing that I just wanted to touch on, I've heard some feedback on, is the communication from the governor's office with the board related to this order. And I just want to take a moment to apologize to every member of the board. When I was having conversations, I was having them with the commissioner, with some of the staff at KSDE, which has been my typical protocol. Obviously, this is a little bit different than what we've usually been used to, and with the change in law. And I should have reached out to you directly to have a conversation, give you a heads up about what thinking was of the governor and the governor's office, and I did not do that. And I apologize that I did not reach out to you directly. I will make sure that I do that in the future, so that way there's no confusion on that point. And with that, Chairman Bush, I'm happy to answer any questions.
Thank you, Mr. Lawrence. Appreciate you being here and sharing some information with us. So board members, if you have clarifying questions for Mr. Lawrence regarding the executive order, if you'd please raise your hand, or again, you could put your question in the chat box if you would prefer. So do we have questions for Mr. Lawrence?
Kathy, I have a question. It's Michelle Dombrowski.
Okay, Michelle, go ahead, please.
Yes, I was wondering how would it affect places like Lake Mary, Heartstrings, KVC, St. Francis, where those are residential students. Those are residential students and need to be taught, need to be serviced because they're living there. How does it affect those people? Thank you.
So I don't know that this order would impact those entities, to my knowledge. And Scott, you may have a different view on that, but my understanding of the executive order is that this would not impact those activities.
Those are residential day facilities, I believe, almost all of them Michelle mentioned. So that probably is the clarifying question she's wanting to find out. What's the impact with those? Because those kids are living there at that facility. They do school, but they're all living there.
Well, the school for the deaf would be the same way, wouldn't it? And the school for the blind? The school for the those students go home on the weekend and typically live there all week and go home on the weekend, back to their homes. And school for the blind, they've kind of been locked down a little bit as well. I was just curious about those two state schools as well.
Yeah, I'm happy to double check that, but I don't believe that they are impacted by this order. They are contemplated differently than a K-12 school and operate differently. So I don't believe this impacts them.
Other clarifying questions? Okay, seeing none, we will move to Dr. Norman. Dr. Norman from KDHE, welcome. We're glad to have you here with us today.
Thank you, Madam Chair. Can you hear me okay? Loud and clear. Thank you. Well, let's start off today with a few numbers. It's Wednesday. We've had 771 additional cases since Monday. So the last 48 hours, 771 new cases brings us to 24,105 cases throughout the state that have been diagnosed as positive. We've had 2 additional deaths since Monday, which takes us to a total of 309. Thank you for the opportunity to talk with you today. I'd like to give just some comments about the science and the public health behind the governor's executive order. We have seen mitigating measures work in congregate settings throughout the state. And again, meatpacking plants, long-term care facilities, and prisons are not schools, but in many regards, they act like schools because they have people in close proximity with each other. We've learned a lot. As an example, we work closely with the meatpacking plants to assist with modifying their workflow of their employees, their scheduling, adjusted what we call engineering controls, the sneeze guards, which are the plexiglass plates, for example, and then assist with screening people when they come into the work settings and assist with contact tracing. We were one of the few states that allowed the production lines to continue. Every other state that had these kind of production lines had some degree of shutdown. So we have some experience in keeping things moving. Shutting down those plants would have had a terrific impact on the meat, in this case, meat production. 30% of the nation's beef came through there. Now, again, I'm not comparing children to meatpacking plants, but we can extrapolate from it. And one of the things that we do know is it will take time to make the recommended changes to the physical environment. It'll cost some money, yes, but it'll take some time to get there. We have seen, I think, a terrific innovation and collaboration among the various education and public health experts who produced the Navigating Change document to guide schools to opening. And there's a lot of information in there. It's a lengthy book, document, if you will. And I think it'll take some time to really understand and incorporate that. But I want to talk a little bit about the science behind several items in the executive order. Specifically, what do we know about this virus, and especially as it relates to children? Information on the metrics we've chosen to guide the reopening of the state in general. And finally, specifically about masks, because I know there's been a lot of countervailing messages out there. COVID-19. COVID-19 is a brand new virus. You'll recall early on, we call it the novel coronavirus, and that's because we know a lot of coronaviruses out there, but this is a completely different one than that. And as such, it's taking a while for the research to catch up, so we really understand a lot about its transmission and its severity and its downstream consequences, long-term impacts. This is not influenza. Influenza, I never thought I'd see the day where I call it an old friend, but at least it's something we know very well. And this is different. Influenza typically, well, first there's mitigating features. We have anti-flu medicines. We have influenza immunizations, and we don't have either of those mitigating factors for this virus. So that's a big difference. We also know that influenza, if you get it and you get over it, you get over it without any kind of long-term consequences. But and I was on the phone early this morning with critical care leaders around the state. It's very clear that we're seeing patients who leave the hospital but are not necessarily completely free of respiratory, cardiovascular, neurologic issues. We've even seen a young person that had to have a bilateral lung transplant because of significant damage. And this is a young person that had no underlying medical illnesses at all, completely normal person. The disease spread. We do know that the disease primarily spreads through respiratory droplets, through laughing, yelling, coughing, sneezing, and the like. And that's usually about a 6-foot distance. In a still room with a poorly functioning HVAC system, the droplets can remain in the air a little bit or travel a little bit further. The virus spreads through respiratory droplets. In Kansas, we are no longer seeing this virus predominantly impact elderly individuals. You'll recall that the very first person that we had that died was an older person in a skilled nursing, and there's been a lot of skilled nursing facility deaths, but that's not where the outbreaks are now. The average age is getting younger all the time. When you look at all cases, I mentioned 24,000 plus cases, the average age is 39 here in Kansas. So, and that includes a whole lot of elderly people early on. So it is dropping down, and in the 18 to 30-year-olds are probably the peak incidence. Not surprisingly, they're the ones that are going into congregate settings without protections, like bars, for example. So we're seeing it come down all the time. This disproportionately impacts African Americans and Hispanics, not just in our state, but around the country. It's also hitting hard those with underlying health conditions I mentioned. This is important in consideration of schools to think through how to accommodate the staff who have underlying health conditions, and or those who have somebody at home or care for somebody or live with somebody that has an underlying health condition, that even if it's not significant illness for them, when they get it, it could be quite significant for the person at home. Good example, I just looked this morning, we've had 14 outbreaks. And again, we closed the schools relatively early on, as nobody knows better than you. And yet through the spring and summer, we've had daycares and other kinds of things going on. We've had 14 outbreaks, clusters in schools. And curiously, of the 44 individuals, the majority of them, all but 3, were in people 18 to 76 years of age. So even if the child or young people get the infection and do okay with it, the staff are at significant risk for it. Again, there's a lack of consensus exactly as to what percentage of the young people are going to have a problem with it. In Florida, a state, as you know, that's been hard hit by the COVID-19, they studied 54,000 Florida children, and 31% tested positive for the virus. So when you think about that, it's very concerning to me, 31% out of 54,000 Floridian children testing positive. Imagine were we to have that happen here. And I think that to get a bit more time to do some of these interventions, I think would be critical and helpful. We are having an ever increasing number of positive test results. We're now up at about 11%. Early on, we were in the low single digit. So it's clear that the total burden of disease is going up. And I'd like to just dispel this notion. People are saying, well, doc, that's because you're doing more testing, that the number of cases is going up. No, the number of cases is going up because we have more disease. If it were just due to, and this is just math, and if it were just due to increasing testing with a fixed amount of disease transmission, then the percent of positive tests would be going down. And we used to be down at 3 or 4%. So if you increase the denominator, without increasing the number of cases, then it would drop, and we're increasing a lot. Okay, reopening metrics. Governor Kelly's Ad Astra plan, you'll recall, for a phased reopening, looked at 3 items, and we still use them every day: disease spread, hospitalizations, and death. A decrease in these metrics signaled movement from one phase to the next. And we have had it's been a bit of a blessing this summer, and I'm going to show you a graph. I'm going to pull up a screen share in a minute of just one graph, but it's very, very telling. We've had overall, for varieties I don't think we need to bother going into here, we have had fewer hospitalizations and deaths on a per capita basis, despite the rapid increase in the number of total cases. So I'm going to pause for just half a second here and pull up this screen share. Boom. Okay. And then I will make it larger. Okay. What we have here is a total picture of the total number of cases from the start until it's about a week old. And the reason is because the logging in the cases takes a number of days to come in from the local health departments. So this is just a timeline, and also the blue histograms show the total number of cases per day. And you can see that on March 16th, schools were closed for the year. And then within one incubation period, 14 days later, the stay-at-home order was issued by the governor. And I can tell you, when you look around the country, but also around the world, the 2 of the things that have the most profound impact on pushing down the total case count was how early or how late was a school order placed and the shelter in place, i.e. stay-at-home order. So what you can see there is we were smoldering along fine there. We knew there was going to be an uptick, and we predicted it was going to be in April, and it was indeed on April 20th or 27th, I think. And then after that, with the phased-in plan, phase 1, limited mass gatherings and the like, started to see a very nice drop in the number of cases. Down on May 18th, phase 1.5, we didn't feel comfortable going into phase 2 because we were starting to plateau off, you see there on May 18th. And then on May 26th, because of legislative requirements and some necessary changes, the Ad Astra plan became guidance and was no longer a mandate. And we absolutely predicted, I knew it was going to happen, and it happened. And that is the counties and local municipalities opened up the doors and said, good, our bowling alleys are back in business, our bars and restaurants, and we don't have to show that same degree of restrictions. So basically now we are on a exponential viral growth phase. The red line is what Will Lawrence earlier mentioned, which is something that's quite unenviable. And since the 12th of July, I don't have it depicted here, the curve is even steepened more. So this is a terrible trend line, and it is not leveled off yet. And until which time the curve flattens, levels off, and drops, I think having mass gatherings of any kind, and that, I mean that a mass gathering, it could be 10 people if you don't have the ability to socially distance. So the things I've talked about that are the mitigating factors that have been very successful have been the school cancellation order early, stay-at-home order early, and the third one is masks. And so I'd like to talk a little bit about masks. Everybody hates masks. I've been a doctor for 42 years. I've worn masks for 42 years, and I don't like to wear them, but I do. Okay. Stop share. Okay, we're back to live humans again here. Masks. I know the mask orders have changed a little bit over time because early on we were quite concerned, and the CDC was quite concerned about having a run on masks and not have masks available for first responders and healthcare personnel. So we're dissuading the public. But if anybody has any questions, do masks work? That question has been asked and answered really since the early 1500s with bubonic plague, and ever since then, But with SARS, which is a coronavirus in 2003 and 4, lots of research has been done. Masks work, and some work better than others, but cloth masks, surgical masks, et cetera, are successful in markedly diminishing the spread. We've learned a lot about it. The coronavirus, and I'm also an Army colonel, was deployed in 2017 and 2018 in the Middle East. There's a Middle Eastern respiratory syndrome, which is a coronavirus, and it's very similar to this one, but not the same. And they don't have a vaccine for it, but they've been successful through these measures, these engineering measures I talked about that we can do in schools through mask use and the like. By the way, it didn't peak out until the 4th year. Just a cautionary note, which I know you don't want to believe that that's the case, but it didn't peak out in the Middle East until year 4. Year 7 years into it, it's still grinding away. We had to be very cautious with ourselves and our soldiers when we were there. But it is highly contagious. But let me give you a specific case example that will be, I think, very convincing to you. And you may have read about it. Springfield, Missouri, there was a hair salon. It was actually a barbershop, more like, where there were 2 of the haircutting individuals, 2 women that came to work ill with coronavirus. One was there for 6 days ill. One was there for 8 days ill with it, fever and the like. They wore masks. Every one of their clients wore masks. 139 clients they saw, and each were 15 minutes or more for a haircut. So a terrific vulnerability for those clients. There was not one single case of COVID-19 transmission that came out of that, despite the fact that these 2 people were actively symptomatic with febrile COVID-19. Pretty convincing. Bottom line, masks work, cloth masks are effective, and probably, and again, we want commerce to flourish, we want schools to flourish safely. Masks are one of the best tools. I think of a mask like a seatbelt. You know, it protects our children, the masks protect our teachers, our community. Final thoughts. Ventilation and HVAC system in older schools may contribute to viral spread. We saw this in Asia, especially with older apartments, buildings and the like. We could trace, and they did contact tracing that showed that older HVAC systems are not helpful for this, particularly if there's large numbers of students brought back at the same time. We worry a lot about higher education, of course, different subject. Online education, I think, is a second best option, but I think that it is something that is maturing. I'll leave that to you people because you're the educators. I'm just the public health voice. I feel very strongly schools are not safe islands in an unsafe community. In other words, if there are communities that have opened up, and you saw the graph, May 26th, and not having mask ordinances, allowing people to go about their merry way, do what they want to, and then are having these spikes that you see on this graph, those are not safe communities. A school cannot be a safe island in an unsafe community where there's a marked increase in the number of cases. That's the same with nursing homes, meatpacking plants, and prisons, for example, because those viruses don't spring up out of the blue in a nursing home. It's brought in from the community. So if schools are in an unsafe community, they won't be safe. I think that is the end of my prepared comments, Madam Chair.
Okay, thank you very much, Dr. Norman. Appreciate it. I'm sure some board members will have questions. Board members, questions? Dina Horst.
Thank you very much. Dr. Norman, why is it that the pediatricians are saying that elementary students don't need to wear masks, in fact, should not wear masks, while it's my understanding that you feel they should? So, or at least it's my understanding that the governor, when she issues the mask, must wear a mask, that it will include those younger kids. So anyway, I'd like to know why the difference in belief.
Right. That's a real good question. And it goes back to the changing ideologies about masks. We have chosen to align ourselves with the Centers for Disease Control because they're the ones that have done the most research on that. I think that certainly kids under the age of 2 have certain risks inherent in wearing a mask. Plus, you can't, it'd be like keeping a mask on a raccoon in terms of the ability to make them do that, and they're just not going to be very successful at it. Also, the question is how much, and this is a value judgment that I can't give you the science basis for, but is how much benefit do you get for the hassle factor of having a mask on young children? And I think it goes back to my earlier comments, and the CDC feels this way too, is that kids can be very active disease spreaders, and even if they themselves are not symptomatic, they will spread the disease. It is a value judgment, but there's, and even the pediatricians will say, yes, we know that it helps to decrease the amount of spread. Also, ma'am, to be real honest with you, I think we need a little bit more information as time goes on to really know, is there a bright line? And at this time, we're choosing to align with the Center for Disease Control on the topic.
I just remind board members, we're not voting on the mask executive order, the other order. I know it's of great interest to everybody. But let's keep our questions to the executive order on delaying school and questions to Dr. Norman. Okay, board members, other questions? Jim Porter, then Steve Roberts.
Thank you. I just want to refer to your information from the Florida report. We said 31% of those 5,400 children tested positive. Can you give us the age range that research was on, please?
I don't have that, Mr. Porter, but I have somebody sitting over here that maybe by the time we're off this, I can get that information for you.
And there's been a tremendous difference. There are people that are telling us that it doesn't impact young children, and there are people that tell us other than that. I would like as much as you can give us how this impacts younger children, and we're talking about, say, elementary children, and the spread. I'd like the most up-to-date information on that. And I know that it may not be definitive, but I'm very interested in what you do know about that.
Sure. Well, first off, we have documented cases from everything from a newborn all the way up to 103-year-olds. The kids spread at most, they are the most effective spreaders after age 10. So it seems to be that kids 9 and younger can have the illness and are not quite as likely to spread it as older children are. By the way, I have a weekly hospital call, and included in that is Children's Mercy, and they do have hospitalized children, including this unusual pediatric inflammatory multi-organ system failure problem. But here, I have your answer here now, sir. This is 18 and under. Back to your earlier question. Those all are under 18. And it looks like that, yeah, 18 under for those Florida children. So summary is kids get it, they spread it. The younger children are less likely to be symptomatic. All of them can spread it, and those 10 and older are the most likely to be super spreaders or to spread to more than one person.
Thank you, Dr. Martin. Dr. Norman, thank you, Madam Chair.
Steve Roberts, next question, Steve.
Thank you, Madam Chair. Dr. Norman, I appreciate your comments very much. But on your graphic with the blue vertical lines and the bright red line that showed the increase, could you help me understand why, with the stay-at-home order from mid-March into April, why that increase was virtually the same as the rate of increase with your bright red line?
Yeah, that's a good question. A couple of things. One is that you'll recall that we had very little ability to do testing. So I think it was actually at the time when the school and then the stay at home, we had a much higher burden of disease, but we just didn't have the ability to do testing. You'll recall, we didn't have test kits. Remember, everything was out in New York and California early on. So we were able to probably document then a little bit further into April what the disease that was actually out there. Now we are flush. We are in the top dozen states for testing per capita. So I think it's a much more accurate depiction of what we're seeing now. It also takes 14 days to run through a complete cycle. For example, just this last weekend, we finally got July 4th weekend out of our hair. One of the reasons you're seeing this big uptick is a lot of those came out of July 4th partying and that kind of thing. We also know, for example, a bunch of people came back to KU and to Manhattan, and the bars and Aggieville have been responsible. It takes about 14 days to walk through that. But I would say, Mr. Roberts, that it was early on, we just didn't have the ability to do testing, even though we knew the illness was out there. It's a good question.
Okay, Michelle Dombrowski has a question. Michelle?
Yes, thank you, Madam Chair. Thank you, Dr. Norman. So my question is, do you disagree then with CMH, American Academy of Pediatrics of Kansas chapter, American Academy of Family Medicine Kansas chapter, and the KU Medical Center? Because a briefing they're saying this week is to get the kids back in school. Even with the Monday morning, CMHH was on Monday morning saying that the most current data is showing with those professionals that the inflammatory disease is extremely rare.
Agreed. Multi-system inflammatory disease is extremely rare. I agree with you. There's not a bright line answer on that, Ms. Dombrowski. We know that it will prevent cases. The question is it practical and can it be supported? And I'm a family physician. Matter of fact, I'm a member of that group. I was a chief medical officer at KU since 2007. And I communicate regularly with those folks too. There's not unanimity of opinion. I wish it were as pure as that. Over.
Yeah, I just feel that I appreciate all the experts' opinions. I think that there's many out there, and I think if there's that many that are saying to go back to school, I think that we need to. If all of a sudden they come out and say halt it, and there's enough of them that saying it, then I think that that's the way it needs to be. I'm looking at Children's Mercy. I'm just looking at pediatrics, and there's a lot of them saying get the kids back in school. So I appreciate.
You don't have to convince me or a public health official. We very well recognize there's many things other than education that are benefits for mental health and for nutrition and all sorts of things. The motivation is absolutely to get kids back into school. No question about it. I just want to make sure that it's done safely.
Yeah, we all want that. We all want that. I think we definitely want a safe return. It's just what's safe and what personal risks and what we need to be taking as far as our families and make those personal sacrifices and choices.
Yep, I agree. I have, my son has had COVID-19. My daughter is a single mom with 2 young boys who's had a hard time keeping her sole proprietorship business going. So I've seen this very much up close and personal as well. I just think we're going to be, in a month to 6 weeks from now, we're going to be a whole lot more knowledgeable. And back to the earlier question, I think by Mr. Roberts, I think we can, I would like to see that in a month to 6 weeks from now, we've not only flattened the curve, but it's on the downward slope. I think we can get there, but I think communities really have to go after it. And I think the schools can be a rallying point around this, because I think communities, if anything is sacred, it's schools and hospitals. They say, we want to keep our schools intact. We want to keep our hospitals intact. And I think that the communities, this could be a very significant rallying point to mitigate the risks.
Thank you. Board members, other questions for Dr. Norman? Dr. Norman, I've actually got a couple. Some of the school people that I have visited with have requested a little bit more I don't know, in-depth matrix as far as future use for what we do about schools. We have the one that's in our continuous or our document, our change document that talks about, as far as working with their local school department or health department, consider using case counts, low restriction, moderate restriction, high restriction, as far as whether they do on-site learning, hybrid learning, or remote learning. But most of the school superintendents I've talked to have asked if there could be something that is a little bit more data-driven than that. And I thought since you're with KDHE, I thought I would specifically ask you. I'm certain this COVID-19 is not going to go away right away. So I think they would like some more data points to be able to look at for future use.
Okay. Yeah, if you haven't been to our website, it is well worth the trip. We have a specific COVID-19 microsite that has not only, and by every county, I might add, it's got new case development, hospitalization rate, death rate, but it also has a percent of positivity and the number of tests that are run, how many tests are run, what's the age range for people that are getting it. I mean, we have a terrific amount of granularity in there, county by county. Now, some very small rural, low population counties, if you have one death, it makes the graph look haywire, right? It's just a pair of small numbers. So you have to kind of see through that. But go to the website and look at the statewide numbers, then county by county. It's very enlightening. But we'll take that. And I've met with some superintendents along the way, and we'll try to do whatever we can. Matter of fact, we just modified our website this morning again, because we're fine tuning it all the time. So we'll work with them on that.
Okay, thank you. Board members would like to refer you in your packet. There are letters from a couple of doctors. Actually, I know one of them is a pediatrician, the other one is pediatrician and also, I believe, a hospitalist, about COVID, and Dr. Stephanie Kuhlman and Dr. Paul Turan about the COVID-19 and its effects on children. So they have some very recent information on there. So if you want to pull that up, I also received an email from Dr. Turan today. And one of the things that he indicated that the AAP, which I assume is the American Association of Pediatrics, do I have that right, Dr. Norman? Okay. Wants to work towards opening school, but only when able, I'm quoting from Dr. Turan, only when able to do so safely and based on science. So that is, as of 8:30 this morning, an email that I received from Dr. Turan to help clarify some of that information. Okay, other questions, board members, for Dr. Norman? Okay, if not, thank you. You are certainly welcome to stay online. We'd like for you to stay online. I would like to, at this point in time, mention to folks before we go into making board statements. First of all, we have gotten a tremendous amount of feedback from the public, and we all greatly appreciate the feedback from our constituents. We've gotten thousands of emails to individual board members. Some of them were sent to all of us, some of them were sent individually. We've certainly looked at all those. I'd like to say I've responded to them all. I've just not been able to. But we really appreciate the input from the public and constituents about this issue. Lots of phone calls also. I have been able to get back with some of those folks, not all, but some, and I'm sure other board members are the same. There's been feedback via social media. So a lot of feedback, various different social media platforms. So we appreciate that. Also, when the executive order did come out on Monday at 4:30, we did put on the website the executive order, and then there was an opportunity for public comment for folks. We actually had about 10,400 comments on that website. I was scrolling through those or going through those yesterday and this morning, so we've got lots of comments from folks. So we really appreciate those comments from all of the people who have reached out to us. We know this is I mean, it's certainly something that's very important and dear to all of us. So we really appreciate those. Also in those comments, we had some feedback from a few groups I would like to mention. Let me grab that. We have board members for your reference. Although there were 10,000 comments, it was well over 1,000 pages of comments. On page 1073 is a letter from the Navigating Change 2020 chairs. On page 1132 is a letter from USA Kansas, which is United School Administrators. Then on page 1133 is a letter from an organization by the letters KSSA, which is the School Superintendents Association in Kansas. And then on page 135 is a letter from Dr. Stephanie Kuhlman. And then on page 137 is a letter from Dr. Paul Turan. And then on page 138 is a letter from the Kansas Chamber. And then on page 1159 is a letter from the Kansas Policy Institute. And then on page 1181 is a letter from the Kansas School Nurses Association. I think that is the letters from individual groups that we received. So if you've not had a chance to scroll through those and see those, you might have an opportunity to do so. Okay, board members, we're going to move forward with board member statements, and I'd ask each of you, I will finish my comments here, and then I'm going to start by board district, and we'll go from board district 1 through board district 10 and allow each member to make a statement regarding their feelings at this point. After we do board member comments, we will have a motion, and then we will have a roll call vote after that. So at this point, I'll ask board member Waugh if she would make her statement, please.
Thank you, Madam Chair. Because I believe this is such a serious issue, I decided to get as much information as possible prior to voting. My top priority is to protect the health and safety of students and staff while providing each student with a great education. Here's a few things I learned. Health professionals support not starting school until the staff members are well trained and hopefully the virus has slowed down. After schools open, it is important for districts to stay in close contact with their county health departments. Superintendents wanted the extra time to make sure supplies were in. Apparently, there are many who have not received everything they need for health and sanitation. They also wanted the extra time to ensure staff members were trained on how to handle this new normal. Just this morning, I received an email from all the superintendents in Johnson County asking to support the governor's order, including things and mention things such as I stated before. Teachers desperately want to be back in their classrooms with students, but many of them are terrified to return. Some are creating, or some of them are creating or revisiting wills. Others are taking early retirement or considering changing careers. Educators overwhelmingly agreed that a top priority for students is to be in the classroom with their friends and their teachers because of the social and emotional support they receive. Parents shared how their children missed classmates and teachers. They also believe that being away from their schools was affecting their children mentally. Other parents are terrified to send their children back to school because of the virus. Several parents said remote learning didn't work with their students. Local board members I visited with supported the order. They informed me they felt it was important for their staff members to be well trained on how to handle this situation And it also allows staff to recognize the district is doing everything possible to provide a safe and healthy environment that will protect everyone. Community members were everywhere, from open schools, normally no restrictions, to don't open until the virus is gone, and everywhere in between. One of the best arguments I heard about voting against this was local control. I served on the Turner board for almost 16 years prior to serving on the state board, and have always felt strongly about local control. I have spent a lot of time visiting with many people on this issue and finally decided that local control was still extremely important because of the differences in our districts. Finally, I concluded that local control shouldn't be included in should not include pandemics, because the virus itself is certainly not local. In fact, it's not even statewide or nationwide, it's worldwide. If we accept this order, we can show our staff, we can allow our staff to receive the proper training to handle this crisis. Teachers were not taught to handle a pandemic when they were earning their education degrees. They were taught how to teach in a classroom, not remotely or a hybrid of both. Teachers could start back on the current return date, but instead of a few days of in-service before students return, they can devote that entire time to being trained on how to handle this pandemic and also be prepared to teach their student area in various ways. In-service days during the school year can be removed and become student contact time. This would allow districts to meet the state's requirement for 1,116 hours for students and still have schools in by Memorial Day. This allows districts time to make sure all supplies are not only received, but the staff is trained to use them and also trained on different ways to deliver education. This will give the entire staff confidence they are prepared to receive students, and their districts have done everything they can to provide a safe and healthy environment. If we don't accept this order, there will be many staff members without sufficient training, and then we are putting our students and staff at risk. My vote will be based on protecting the health and safety of our students and staff while ensuring they receive a great education in any way the districts determine. Thank you.
Thank you, Board Member Wall. Real quick, I referenced some individual letters in the document. And I want to make sure those are all documents are in the thousands. The numbers that I gave, I think some of them I might not have included the 1,000, but those are all in the 1,000s. Sorry about that interruption. Board Member Roberts, your District 2.
Thank you, Madam Chair. Fix American Education Starting in Kansas, March 2017, AD. Begin with the State Board of Education's vision. Kansas leads the world in the success of each student. The following ideas could be implemented in any state by its board or governing structure. Any community can provide an excellent education for any student who wants it. The last three words of the previous sentence are essential. Who wants it? A teacher need not matriculate at a college of education in order to be an excellent teacher. Most solutions to problems do not require additional resources, additional revenue, or additional expenditures. We'll fix high school when we fix second grade. We need smaller classes in lower socioeconomic areas, particularly for younger students, immediately yesterday. Let kids be kids. Encourage recess for early primary students without many rules. Let children play. Stop treating teachers as clerks. Expect professionalism and pay teachers as professionals. Welcome the public citizenry into our public schools. Many students mentally drop out of school in 3rd or 4th grade. It's fully apparent after another 5 to 7 years. We imprison too many in America, and we have an educational system to blame for some portion of that. Stop labeling children by color within our schools. Don't label students by race in groups or subgroups. Decrease reliance on property taxes. To fund schools, money should follow the student and more equitably. Math standards should be succinct and to the point. A short list of actual standards should be met before advancing. IEPs should return to the 1 or 2 pages they used to be. Practice arithmetic. Primary teachers who cannot do simple math word problems should be thanked and terminated. Primary class sizes should approximate about 150% of the average age. For example, if you have 6-year-olds, you should have about 9 in a class. Lecture halls should be implemented for technical courses in high school, apart from small sections for lab work. Eliminate the federal free and reduced lunch program. All kids should be fed with taxes. You can still bring your lunch. Teaching is not union work. Encourage teacher unions to morph into professional associations. Let welders teach welding. Let attorneys teach civics and government. Let engineers teach trigonometry. The test for professional teacher licensure should come after a teacher's on the job, not before. There should be 2 licenses for professional teachers, an initial license and another one we could call professional. Great teachers should be paid a high-end salary after 3 or 4 years on the job. Teachers should be able to prohibit mobile phones and earbuds from classrooms. Good teachers already do this. Professional development for any instructor should be the sole responsibility of the individual teacher. Sing Christmas carols, but don't prohibit non-Christian religious songs or poems. Art and music, civics and history, scientific inquiry, and basic responsibilities are just as important as math and English. Spell correctly, use good grammar, expect correct answers beginning in primary school. Take the birthday out of the equations for math class attendance. Master basic material before advancing. People are spiritual animals. Appreciate this fact. We need to believe in something bigger than ourselves. Do not try to plan everything from the central planning office. It leads to shortages from bus drivers to teachers. Reduce mandated testing. Good teachers make their own quizzes and exams. Trust them. Consolidation should fall on administration the most and high schools somewhat. Primary schools are hurt by the C word. Give teachers the authority and the responsibility to manage their classrooms without distractions. Let kids use knives and forks at lunch. Let chemistry class have chemicals. Let students have scalpels in biology class. Keep calculators away from early primary and primary math students. Make exceptions for exceptionalities. And read, and then read a lot. Then read some more, and after that, read. Then do some more reading, and short read. Then read some more. Quit giving every kid a trophy just for showing up. Colleges of education should help prepare future school managers, principals, and superintendents. Choice of school must no longer be simply for the affluent and the creatively able. Poor folks need school choice too. Many future jobs and careers for today's youngsters have yet to be invented, developed, or even envisioned. Least restrictive environment for special persons, not always the better environment. High schools need more flexibility in the awards of credits, certificates, and other recognitions. Restorative justice is not for everyone, but it holds a great deal of promise to help change the culture. The culture of education needs many basic reforms. The elimination of traditional ordinal grades would help a lot. Education's more than process. It's more than knowledge. It's an amalgam of love and gumption. Now is the time to make justice a reality for all of God's children. Any state, any community, willing to provide an excellent education for any student who wants it shall do so. Political will is lacking in America these days, but I think the pendulum is starting to swing. Recognize that families have an important role to play. It's not the duty of government to ensure that every child receives an education. Rather, the responsibility of government is to ensure that every child has the opportunity for quality education, and all citizens should read well and understand numbers. I will be voting no on the governor's executive order. Thank you, Madam Chair.
Thank you, Board Member Roberts. Board Member Dombrowski.
Thank you, Madam Chair. I feel this should be a local decision. Western Kansas is in Wyandotte County and vice versa. We have to listen to Children's Mercy, AAP of Kansas, American Academy of Family Medicine of Kansas, and KU. You've heard, and I've heard from local board members, many parents, and many teachers. Our teachers, we're so proud of them, and we need them, and there are experts, and we need to be listening to them. And a lot of them want to go back safely. They've said they want to go back safely. I think we should be listening to the doctors, not the politicians. I think that, like I said, the delay right now affects the less fortunate, and I feel like we need to be fighting for them the most. The less fortunate right now are being pushed further and further behind. The districts have been preparing for this, and they are prepared. We're giving parents the choices, and I think we need to continue to do that, and I think this needs to be a local decision. Thank you very much.
Thank you, Board Member Dombrowski. Board Member Ma.
Thank you, Madam Chair. Well, it's no secret that when I first heard about the governor's plan to delay school start statewide, I was a no. It was all about flexibility and local control for me. And folks who know me won't be surprised that I question everything and I tend to buck authority. But this isn't about me. And in a time of a pandemic, it's not about local control either. If Kansans wanted local control over all aspects of education, we wouldn't even have a state board of education because some issues transcend local control. So I decided the smart thing to do was to let those whose very lives are most impacted decide. After getting input from administrators and local boards, teachers, parents, and community members, the overwhelming response was for me to support the governor's order, and not by a small margin. Nearly 100% of the teachers and more than 70% of the community members, local board members, and administrators support the delay in my district. I won't go into all the pros and cons. You've heard most of them. Perhaps the most compelling is that we are asking schools to redesign now to move the timeline up, and they are asking for time to make that happen, and we just say no, really? But in addition, and even more importantly, I want to be on the right side of history on this one. And I want to be able to say that when I had the chance to save children's lives, I voted yes. And that is my plan now. Thank you, Madam Chair.
Thank you, Board Member Ma. Board Member Clifford.
I appreciate the many emails, letters, phone calls, texts, posts, and public comments from individuals and organizations across Kansas. I do believe we must ensure our schools are as safe and ready as possible when they open, and that students want and need to resume their education as soon as possible. I don't doubt the severity and impact of this virus, but this virus is not the same across our state. It has affected different areas of our state in varying fashions. One area may be experiencing significant outbreak, while another is experiencing no or very low case numbers. In my area, about half of the counties have 0 or single-digit case numbers. In order to have our schools open and provide the best education possible this year, we must be able to take advantage of those times in our own communities when we are not experiencing rising cases. Delaying school start is not without a variety of risks to students in other areas as well, including social, emotional health, and many others. Specific school opening dates are not mandated, and there is nothing in this executive order that could not already be done by any district if it chose to do so. Districts can determine their start date as they see fit at this time. Those districts who do not feel they are ready to open can and should delay or consider delaying their opening. I believe districts should work with their local boards of education, their health departments, their staffs, students, parents, and communities to determine when schools should open. Those with scheduled August openings currently could reconsider whether they need more time or not. I support our superintendents, our local boards of education, teachers, staff members, students, parents, and communities, and believe they are in the best position to know what is right for their schools. And I believe we need to allow districts to educate students when and where they can safely do so, and that will not be the same for all districts across our state at the same time. Our Kansas Can vision is Kansas leads the world in the success of each student. And I believe the best way to accomplish this is to not affirm the executive order and to allow districts to choose the start date of school that works best for them. Thank you.
Thank you, Board Member Clifford. Board Member Horst.
Thank you, Madam Chair. I do not disagree with the need for training, for consideration of all of the COVID issues within communities. Nor do I disagree with the idea of delaying. What I have issues with is we are stripping, by approving this executive order, we would be stripping the elected local boards of their statutory duty to make these needed decisions. Instead of focusing where the spikes are occurring, we have a one-size-fits-all solution. For my small rural districts, the governor's EO, and excuse me for shortening the two words, but it is problematic. There is a big possibility that the counties that haven't experienced a spike in the virus may experience it at some point. And they may need the days that they would have had if they started in August so they could take the break to allow the virus to calm down somewhat. Under this one-size-fits-all mandate, even if they have no COVID outbreak, such districts will potentially have to hold school in June when many of those rural communities are planting and harvesting. And they expect their kids to be the help at their farms. It isn't right for the state to impose a solution on non-COVID experienced communities that reflects on the COVID experience, which is occurring in more urban communities, such as where I live in Salina. It's not as bad as Wichita or some of the areas in Johnson County at this point, but I would consider my district needs to sit down and reconsider when they start. In addition, I find Labor Day is a curious day to choose when we would draw a line in the sand, particularly when we know it is a weekend where we usually see large gatherings. Likely see another spike after Labor Day. So why make it the target day? It may be better to start in mid-August so we can deal with the possible cases that COVID-19 will show, in other words, that COVID-19 would show back up. Many of my emails mention student hunger, learning gaps, mental issues, and other problems that children are experiencing because they have not been in school for such a long time. Obviously, the longer they are out of school, the greater those problems become. My belief is that we have to provide an immediate protection for those children whose lives are more negatively impacted by not being in school instead of being impacted by virus concerns. I feel that it would have been much better had the governor worked with those local districts that have the COVID increase and allowed local control to be in place and allow those local districts to make the decision that's best for them. Many of the districts had plans in place and had even put them in the paper before this came out. It's very confusing to the parents to have their local district making a decision that is trumped, in a sense, by the governor's executive order. I have, as I stated before, I believe those districts that are impacted by spikes need to sit down and reconsider their start dates. But I have issues with my small rural districts who, for no fault of their own, and they have no COVID increases in their community. I just think it's wrong for the state to treat them the same way as we need to treat those who have the spike. And I think we can do that more effectively with the ones that have issues than making a blanket statement across the state. So, no, thank you.
Thank you, Board Member Horst. Board Member Jones?
Thank you, Madam Chair. I also want to echo the sentiments of hearing from across the state, but especially across my district, from teachers, which have been a bulk of my calls, administrators, which I've heard from most of my school districts, local school board members from my 39 districts and my within District 7, as well as our conversations with the governor's office and legislators, as well as many parents over the last week. It is no doubt that many school districts within District 7 must take the time to train teachers to effectively teach online, providing the professional development they needed, as well as the other professional development that we have urged districts to do prior to the COVID-19 regarding the Jason Flatt Act regarding student suicide and mental health, and dyslexia. Several districts have had supplies on order since the beginning of May and have yet to receive those PPE supplies, whether they be thermometers, at the entrances, masks, and other items. However, knowing this, the timeline to achieve this is much different for different districts. Smaller districts can do this in a quicker way as they have smaller staff and a smaller area to cover in terms of personnel. Our districts already work in a collaborative way to develop a regional policy. Talking to superintendents, most of them have discussed after coming out of a meeting with their superintendent cohorts in their counties and areas to help make decisions and to discuss about it. The timeline is different for every community and every school board to address this, and this executive order does not give that flexibility to our local districts and the timeline for our districts. I'm also concerned that this executive order will set the modus operandi of how we will govern this pandemic this year. From the last 2 months of discussing as a state board in our board meetings, that we will govern in a local way. We will address the closures, not statewide, but by area where they are spiking, and it will be different times and in different places. COVID-19 is real. It is not fake. I have discussed this with survivors of COVID-19. But I urge my colleagues, and as listening to the many, many varied opinions from my district, I believe that the right thing to do is to turn down the executive order and to give local districts the time, the levity to operate within their own timelines. Thank you, Madam Chair.
Thank you, Board Member Jones. And I will make my comment. When we had this executive order brought to our attention last week, when we were up at Topeka at our State Board of Education meeting, one of the things I decided immediately that I was going to do is make certain to do my own homework. I was going to listen to my constituents, which I did. I listened to them via email messages, via phone messages, and via social media. I talked with my own District 8 superintendents and had conversations with them regarding what their needs are, what they feel their teachers need, their community, their local communities need, and what their students need. Then I made a decision to talk to local medical experts. It's pretty easy to get on the television and listen to a medical expert from Washington, D.C. or wherever else, or to get on the internet and seek out medical opinions from various different folks via the internet. But I reached out to and was able to talk to 5 different local physicians and medical experts regarding COVID-19 and their recommendations. All of their recommendations, 3 of them were pediatricians, talked about the fact that, as Dr. Norman said, the young children are getting COVID. They have a tendency not to spread it as much, but the older children are getting it at higher rates, and they're spreaders now more than they used to be. I also talked to those experts about what they felt like needed to happen. They were actually all in support of Governor Kelly's mandate. I also, after that point in time, listening to those various groups, I decided, okay, I had 2 more things I needed to do as far as my homework was concerned. One was listen to my fellow board members today and listen to their comments from their constituents. And then listen to Dr. Norman today from KDHE and the expert as far as the statewide view. Now, I'll have to say the executive order is not exactly what I would have liked. There's some other things that I would have preferred on the executive order, but it is what was presented to us. When I think of our schools and I think of what they're going to need to do out into the future, I think of the things that they're going to need to do. they're going to probably need to be prepared to switch to different methodologies of teaching throughout the year. They will start in the on-site learning model. Some of them may start in the hybrid learning model where some of the kids are in school and some of the kids are out of school, not out of school, but teaching. The teachers are working with them in an online model. And some of them will probably start or be switching to a fully remote model at some point in time. We are asking our teachers to do a lot of professional development in a very short period of time to make sure that these changes are quality and proper for our students. They need time to be able to deeply prepare, not only for the operational things that this pandemic brings. We all know in our own homes, I've had to find masks. I've had to get my own sanitizer, all those kinds of things. Well, the level of which that'll have to be done in the school is significant. And they'll also have to have times to figure out how do they switch to completely different teaching platforms. Now, they have done some of that, but we all feel like that what we did last spring wasn't the rigor that we want. So we are asking folks this year to provide additional rigor in that instruction. And we've asked the department through our commissioner to provide for more extensive learning opportunities for our teachers so they are able to make that switch to different learning modalities during the school year that we know they're going to have to do. You know, this pandemic, and I am an advocate also of local control. This pandemic is not local, as one of the other board members say. It is throughout the state right now. It is in all but 2 or 3 counties. And, you know, I'd have to say, unfortunately, we are a very mobile society. We move from city to city, county to county throughout the state. And sometimes some of our folks are not staying home very well. So even though I advocate for local control in this situation, in order to get our teaching staff and our students, because when our students come back to school, our teachers need to work with them to prepare them to understand how to learn remotely. We tried that last year and it went okay. It wasn't great. We want great. So to provide that opportunity for those folks to be able to do a great job with different modalities of instruction, I'm going to support the executive order to allow that flexibility among our districts. Okay, I'd ask Board Member Porter at this time.
Today, we are being asked to make a binary choice. Do we support or reject the executive order? However, we do not live in a binary world. All of us have had multiple contacts supporting both the approval or rejection of the executive order, and each of us will have to decide for ourselves what is the best for all concerned, and there are powerful arguments for both positions. We have been told that returning to school at the appointed time puts the lives of both children and the adults that serve them at serious risk, and they are right. We have been told that for social emotional health, especially for services for students with special needs, school needs to begin as scheduled, and they are right. This body, through collaboration and relationships, has been able to impact many issues facing students today. Some examples are the Mental Health Advisory Council, the Bullying Task Force, the Vaping Task Force, Dyslexia Task Force, the ESI Task Force, the Transition Work Group, the Juvenile Justice Task Force, the Computer Science Group, among others. We were able to effectively address these issues because we were at the table. This executive order could have been better and eliminated some of the unintended consequences had we been at the table, and we were not. Unintended consequences that must be addressed include the inability to achieve the required number of hours for credit and/or certification for students enrolled in career and technical and concurrent enrollment courses. Part of this has been addressed, but many of those classes are taught by teachers in their own schools, and they would not be able to continue under this order. Also, employment contract issues related to the required 1,116 hours if teachers are involved in planning for 3 weeks before school starts may not be possible. On the other hand, the state of Kansas would be in a better place if the legislative leadership had chosen to work with the governor to put in place strategies that stop the spread instead of doing everything within their power to thwart her efforts. I find it ironic that some of those same leaders whose choices may very well have contributed to the increase in cases are the ones who are encouraging our constituents to pressure us. I understand and appreciate the Shawnee County social distancing restrictions that prevent us from meeting in Topeka today. But I also find it ironic that we are deciding the wisdom of sending 500,000 school children and tens of thousands of employees back to school from the comfort and safety of our own homes. I do not know where we will be in 3 weeks or 6 weeks. I hope we will be in a better position, but based on observing the willingness of some people to refuse to take the necessary safety precautions, I fear that it will be worse. And now for the binary choice, which we are all forced to make at this time. Because I believe the crisis is real, and because I don't believe that enough of us are taking it seriously, I will vote to support the executive order. I don't know what the outcome of our decision will be, but whatever it is, we need to move forward to work together to help assure that 500,000 students, for whom we are all personally and collectively responsible, are receiving the best possible educational services in this extremely difficult environment. Thank you.
Thank you, Board Member Porter. Board Member McNeese.
Thank you, Madam Chair. And I want first to start by saying thank you to all the constituents in my district and across the state from all walks of life who have contacted me and expressed their feelings in very valid and very rational ways. And I appreciate that. And to my fellow board members, thank you for your hard work during these past days, receiving calls, talking to people, listening to their concerns and their issues, and processing them. I respect each and every one of yours decision that you've reached individually regarding this challenge that we face today. I also want to thank all the districts across our state for all the planning and all the work that they have been doing. This situation we're in right now has asked districts and all the district employees and boards and citizens to rethink school and to think deeply about the values and the challenges that they face. I want to say one thing before we move into the next part. We're not going to change the number of people who are impacted by this only in school. It's going to take masks, social distancing, and following other health and safety measures as recommended. There's not one size or one thing that we're going to do that's going to change it. It's all of us working together. There are some things that make a difference and imagine in a very clear and definite way. But before we get into that, I do want to go back a little bit to the draft of navigating change. And the navigating change, which was passed unanimously by our board, seems like a long time ago, is a great plan put together by Kansans to serve Kansas. And in the draft and discussion before it came to the board, I challenged Commissioner Watson that the operations section of the plan should appear first, and that the instructional part, which was a vast number of pages, of 85 to 88% of the entire draft of over 1,000 pages, had to do with instruction. The operations side dealt with the immediate safety of students and staff and communities, while the instruction dealt with providing high quality instruction and guidelines and protocols for teacher teams and cross curriculum teams to be prepared to serve students and provide that better experience than we had with continuous learning earlier. Continuous learning was the best we could do at the time, but navigating change is a lifetime away from the continuous learning. I have to say today that I understand much better why Commissioner Watson wanted to focus on the instructional side, because we're all going to do the operation side, but we're not going to be as well prepared as we could be without extra time in developing the instructional components of navigating change. When it was first presented to us at our board meeting, I was the first one to respond with questions and statements. The first question I had for the commissioner and for the team presenting the navigation change was, how much time was it going to take to implement the changes and the way we wanted to do school? Could we be ready by the time school started? I've always been concerned about that, because you can't ask schools to change and implement navigating change. And I'm sorry to say we haven't heard much of this during our discussions here, but navigating change is what's going to propel us in and serve our students in the academic side. And that is of great importance to me. We are going to do a great job regardless on the other side in terms of the operations. I have great confidence we'll be doing that. But my first statements and questions had to do with time and resources relative to implementing navigating change. And they're still there. I'm not sure in just 3 weeks or even 6 weeks we're going to have the change that we wish. I do have confidence, regardless of what the decision is today, that the school employees, teachers, administrators, cafeteria workers, custodians, office workers, all those who work in our schools and are part of this, will do their best regardless of the decision that we have today to protect our students and to provide the best quality education. But I have to say something that I haven't heard. This is a continuing battle. This is not going to either be better or worse today. Starting later may keep us in school longer, may make us better prepared, will certainly prepare us better to provide for the safety of the students. So I am very concerned about the vulnerable students that we have. Probably 20%, 15 to 20% of our students are vulnerable with underlying health issues, as are the staff that work there, whether they be in the classroom, cleaning the classroom, or serving in the cafeteria. I'm worried about them. The better prepared we are, both in the instructional and in the operational side of navigating change, the better we'll be, the longer we'll stay in school. So my vote will be a yes to support the governor's executive order. Thank you.
Thank you, Board Member McNeese. At this point in time, I've got a couple clarifying questions for a few of our folks before we vote. First of all, Mr. Lawrence from the governor's office. This professional development's really going to cause a lot of needed work. Is there any ideas of what supports we may expect from that, or what help we may have from that?
Thank you, Chairman Bush. Absolutely happy to have whatever conversations we need to have on professional development. We do have the Governor's Spark Committee that is handling the CARES Act funding, and this would be something that we could talk about from a professional development standpoint, if we could fund some of that for our teachers, particularly in getting ready for online, if they have to teach online this semester. So happy to have those conversations and can set a meeting as quick as possible to do that.
Okay, thank you very much. I appreciate that. The other questions, clarification, just a reminder as far as the vote's concerned. Scott Gordon, if you'd kind of clarify what kind of vote means what.
Sure. So in order to adopt the resolution, it is a vote by a majority, a simple majority. So 6 of you voting yes means that you are adopting the resolution. which means you are affirming the executive order and it goes into effect. A no vote means you do not support, the opposite, obviously. It means the resolution will not be signed by you and the executive order would not be able to go into law.
Okay, so a vote of yes affirms the executive order and a vote of yes denies the executive order, for lack of a better word.
I think there's a slip of the tongue there. A vote of yes means you affirm the executive order. A vote of no means you do not approve of the executive order, and it dies.
Okay, all right. So clarification purposes. Okay, board members will move to our roll call vote at this point in time. And again, I will go by board member districts. Mr. Porter has a question.
And we need a motion.
Oh, thank you very much. I appreciate that. I'm ahead of myself. I appreciate that.
Norm,
And in that case, I move that the Kansas State Board of Education affirm the proposed Executive Order 20-58 by a resolution that this executive order is in the best interest of the students in Kansas.
Okay, thank you. We have a motion for the order. Do we have a second?
I'll second.
Okay, we have a second by Ann Maw. Okay, so now we will move to the roll call vote as the motion has been moved and seconded. So we will start District 1, Janet Waugh.
Thank you, Madam Chair. I vote yes.
District 2, Steve Roberts.
Thank you, Madam Chair. I'll vote no.
District 3, Michelle Dombrowski.
Thank you, Madam Chair. I vote no.
District 4, Ann Maw.
Thank you, Madam Chair. I vote yes.
District 5, Jean Clifford.
Thank you. District 5 votes no.
District 6, Dina Horst.
Thank you, Madam Chair. I vote no.
District 7, Ben Jones.
Thank you, Madam Chair. I vote no.
District 8, Kathy Bush. I vote yes. District 9, Jim Porter.
Madam Chair, I vote yes.
District 10, Jim McNeese.
Madam Chair, I vote yes.
The final vote is 5-5, so the order is not affirmed. Randy, any additional comments you'd like to share with the board?
I want to thank the board for their work this week. I want to thank Will Lawrence and the governor's office, Secretary Norman, for coming today. We will be briefing superintendents at 12:30 tomorrow, both on Executive Order 58, which was just not affirmed, and also on Executive Order 59, because that I think there's a lot of people still misunderstanding the state board's role in that. So you're always invited to that. That will take place at 12:30 tomorrow with the superintendents. But thank you for your work today.
Okay, thank you, board members, and the meeting is adjourned.